Welcome back to Yahoo Finance Live. Of course, telehealth surged to the forefront of healthcare in the pandemic, but one healthcare startup is playing a unique role on both sides of the work-from-home environment, also helping out in the return to office life. Eden Health not only offers a digital concierge telehealth app that connects people with care in real time, but also operates in-person clinics to provide healthcare for employees at some big name companies around the country that you might have heard of before, including Harry's and others. The company just raised another $60 million in a Series C funding round, bringing Eden's total funding to $100 million since its launch back in 2016. And joining us for an exclusive Yahoo Finance interview is the CEO of Eden Health, Matt McCambridge, joins us now. I should also note Matt recently named to Forbes' 30 under 30 list as well. Matt, congrats on the funding, man. I want to get into that in just a second. But first, you guys have been playing a crucial role for employers navigating all this, setting up testing and shifting to vaccination efforts as well. So what are you hearing from execs when it comes to vaccinating and getting back into the office safely?
Yeah, well, no question that COVID is the health issue of our time, right? It affects every single person from the C-suite down to people who are working on the front lines of the organization. So when we think about COVID and vaccination returning to work, it's really making sure that their business can be have continuity. And so we're actually seeing that nearly 9 in 10 employers are making COVID-19 vaccinations mandatory for employees. And they're looking to give incentives for people to make that more palatable, like things like PPE, wellness program, other kinds of incentives beyond obviously the important incentives around being healthy. And then 70% of employers plan to make COVID-19 vaccines available themselves. And so the vaccination push is really important for employers to get back into the office.
I mean, 9 out of 10 that's a pretty high rate when you talk about requiring vaccines. And I wonder what that means for the timeline. What are you hearing from some of these companies when you consider that vaccines are going to be required to come back to the office, but there's still question about when, in fact, the supply will be there in order to vaccinate all the employees?
Yeah, I mean, the supply can still be up in the air. We've seen a massive increase in supply, though, and we're sort of forecasting that to continue. So we see employers targeting sort of the beginning-ish of summer, June, July. We also see employers talking about Labor Day, but it's really looking like for most of our customers, the push is definitely this year.
Yeah, it's interesting because you guys obviously have that telehealth side, the app side of the business, which works great. And now you raised another $60 million just months after your Series B. So, I mean, if we are going to see employers maybe wait longer to get back to the office, as you're saying, not till the summer, how do you want to use that money? Where does it go to? Does it more kind of focus in on the digital side of the business, or do you anticipate needing to spend a little bit more to build out your guys' kind of clinic side to focus in on people getting back into the office?
Yeah, it's a great question. We're basically focused on 3 areas. So we already provide virtual care in all 50 states. We've done that for a long time. That's really the bedrock of what we do. We provide these trusted clinical relationships everywhere. But physical is a huge thing for us as well. So we have physical primary care offices in the greater New York City area, in New Jersey, in Chicago. Chicago is a huge market for us. We're opening a lot more physical infrastructure there. We also have our eye on locations like Boston, DC, Houston, Los Angeles. And so when we think about Eden as a whole, it's providing us trusted relationships in a bunch of different modalities to make it as easy as possible for our members. The second area of investment is in our platform. So bringing more into the options and ability to take care of your whole health to the fingertips of all of our patients through our virtual product. And then finally, investing more in our providers. We have the best providers in the business. We consistently hear how great they are from our patients. And we want to make sure that those individuals have the best training, the best resources to make sure that those relationships with patients are continue to be solid and the best in the business.
Matt, how are you looking at the mental health piece of all of this? It does feel like really employers have shifted the priorities in terms of offering any kind of help for a lot of their employees, especially given that so many people have worked from home, so many have been alone throughout the pandemic. What kind of opportunities does that demand provide for Eden Health?
The mental health piece is just one of the biggest parts of really what we're seeing in healthcare overall. every piece of COVID has to do with mental health. If you are getting sick, your concern is what's going to happen to my family, what's going to happen to me, what's going to happen to my community. So the important area that we play is, first off, primary care is the place where 70% of mental health issues are diagnosed. And so primary care is really the foundation of getting good access to mental health services. The second piece is we actually have full-time therapists, psychiatrists to work with our patients. So not only is it in the actual diagnosis around COVID, but it's all the anxiety that make depression, other kinds of behavioral mental health issues that are coming out of this as well. So primary care is this great foundation, but we even extend that further with the ongoing care that might be more intensive, like talk therapy and things like that. So this is a really huge opportunity and a huge priority for employers that they have to address with getting back to work.
Yeah, and perhaps part of the reason as to why we're seeing that Series C come just a few months after that Series B and another $60 million in the business. But congrats on that. Matt McCambridge, the CEO of Eden Health. Appreciate you taking the time to chat.